I'm your moderator. My name is Peter Ashenden. I'm the Director of Consumer and Employee Affairs for Optum Health. I've been in this position now. This is my 7th year of working for this company. I love the work that I.N.A.P.S does. I'm a strong supporter of the work that I.N.A.P.S does. And I really support, especially these webinars, because this is a way for us to get information that we need to do our jobs better. So that's why Optum has taken a very serious role in supporting these particular webinars. Can we go to the next slide, please, and get rid of that ugly picture of me? Thank you. The webinar series is presented by members of the International Association of Peer Supporters, I.N.A.P.S, with generous assistance from Optum, without whom the series would not be possible. I.N.A.P.S Resilience Incorporated is solely responsible for the content of the webinar. And again, we always thank you for your participation. Thank you for coming in. Thank you for spending time with us. Thank you for all of the things that we know that take time out of your day, but you're willing to take time and to take it and try to learn new skills so we can help our members even better than we already are. Next slide, please. Disclaimer, these webinars are recorded and available on the I.N.A.P.S website for future viewing. As a participant in the webinar, your name, if you choose to provide it, in the chat function may be included in the recording. If you prefer not to be identified by name, go out and sign back into the webinar without using your name. You can do it anonymously. And again, we always thank you for your participation. Next slide, please. Certificates are an I.N.A.P.S member benefit. If you are a member of I.N.A.P.S, there will be additional instructions on how to obtain a certificate of attendance for your 1 hour of continuing education that will be provided at the end of the webinar. This information will be available to those individuals that are looking to get a certificate. But unfortunately, to get one of your certificates, you do have to take and be a member of I.N.A.P.S to get that certificate. And I believe our cost is very, very nominal when you look at fees for associations. I believe our fee is $25 a year, if I'm not mistaken. Is that correct, Rita?
That's right. That was for this year.
Okay. And so now's the time to take and join, because what I hear is the dues may be going up, but I don't know anything about that. I'm not sure. Let's take and go to the next slide, please. And at this point, I believe I'm going to turn it over to Scott first. Is that correct, Scott?
Actually, we're going to turn it over to Lori for the screen.
Okay, then let me take, if I can, just take a moment and introduce Lori, Jean, as well as you, Scott. We're very, very fortunate to have 3 extremely talented people. Lori Ashcraft, Jean Johnson, and Scott Palluck have been national leaders in the peer movement, in peer recovery, and peer resiliency. All of the things that we stand for and support, they have been doing for many, many, many years. Again, they're taking time out of their extremely busy schedules to be with us. I know that Lori just came back from a grueling trip in Singapore, and yet here she is on the call with us, taking and putting her own personal issues aside so that she can take and bring skills and knowledge to the people that are participating in this webinar. So at this point, let me take and turn it over to Lori, who will take and further introduce Jean and Scott as we go into the presentation. Lori, can you take it away?
Thank you so much, Peter. It's just a privilege to be here talking about this particular topic. And just so you all know, I cannot put my dog on mute, and whenever I get on the phone, she gets her squeaky toys out. So if you hear squeaking in the background, just know that that's my dog making a contribution.
Well, Lori, that's probably going to get Bella barking too, because she's sitting right here next to me in one of the office chairs.
Okay, well, hopefully they'll give us a break.
I hope they will.
Before I get started, I just want to second what Peter said about I.N.A.P.S and joining. It is only $25 a year, and there's a lot of benefits to it. So if you're on the call and you're not a member, we hope you'll take this opportunity to join us. Okay, on to our first slide here. And Peter did such a good job of introducing me and Gina Scott. I really don't have much else to say about us. You'll be hearing from all of us as we roll along through this material. I do want to say one thing about the Affordable Care Act before we get into more depth here. And that is that, we've all been so moved and concerned about the issue of people with mental illnesses dying so much earlier than the general population. And there hasn't, we've tried to impact that. We've set goals around that all across the country. People are offering classes in care and all the things, and smoking cessation and so forth, all in an attempt to narrow that gap between lifespan of people diagnosed with mental illness and the general population. Well, here's the best kept secret about the Affordable Care Act. If people can get signed up for this, they can get the health care that they haven't had the opportunity to have for so long. So why is this important? Why are we spending so much time talking about this? Because that's our goal overall, to reduce that discrepancy. So what we've tried to do, and you'll see as we go along here, and Scott has been the primary architect on this, is to try to take something that's kind of complicated, like the Affordable Care Act, make it really simple to understand, and give you ways, as peers or others, to help people get enrolled. And then you'll be hearing something about Churn, and Scott will explain that. But what that means is, how do we keep people eligible? How do we keep people eligible? Because it's one thing to get people eligible, another thing to keep them eligible. If their income changes, if their other points of status change, then they're not eligible. And they might not even know they're not eligible until they go to the doctor and find out that they don't have insurance. So this whole day, this whole presentation that we're going to be giving to you is about learning how peers, honestly, if you're a peer, you are in the best possible position to help somebody understand the benefits of this, because you're so good at engaging and relationship building. So what we're trying to do today is give you tools to get people to understand this benefit, to sign up for it and take advantage of it as a very primary way of addressing their health issues and helping them take advantage of life-saving and life-extending services that haven't been available to them in the past. So I think with that, I'm going to turn it over to Scott to tell you exactly what our objectives are today. So, Scott?
Well, hello, everyone. As Lori stated, we are so happy to be with you this morning to be able to share with you some of the things that we have been learning. And so for today's webinar, Peers Educating Peers on the Affordable Care Act, our webinar objectives include finding out about this extremely exciting project involving N.A.P.S, the International Association of Peer Supporters, and Resilience. The Peers Educating Peers on the Affordable Care Act truly is an exciting project, and we're absolutely thrilled to be a part of it. And Lori's going to share with you how we got involved in this project and what some of our goals are for this project. We're also going to learn a bit more about the Affordable Care Act And that's going to include understanding several of the key provisions that are part of the Affordable Care Act, why the ACA is important, and even more specifically, why the ACA is important for individuals with a mental illness in California. We're also going to discover the important role that peers play in supporting individuals enrolling in health insurance and eliminating churn. And if, Lori mentioned the term churn. If you're not familiar with it, don't fret. We will explain what that is. And then lastly, we'll look at some of the strategies that we are using to address the challenges that we've learned about thus far. Okay? So I'm going to turn it over back to Lori, and she will share with you a little bit more about the project itself.
Okay, I'm just going to first of all tell you how this came about and how we became interested in it. This was a SAMHSA-funded project because one of their national goals is targeting that discrepancy in terms of lifespan. So this is one of the ways they're addressing that goal of reducing that discrepancy. And they funnel the project through something that we all call brass tacks. We probably know what that means. We probably are more familiar with that term than the longer explanation, which is bringing recovery supports to scale, technical assistance in their strategy. So that's where the project came from. It's funded from April 1st of this year through September 30th. And as part of the requirements, we had to focus on one state. And we chose California, partly because California already has a lot of people enrolled, but they don't have the toughest people enrolled, the people that really need it the most. So while they have a lot of enrolled folks, there's still a group of people out there who could really benefit from it and haven't been reached yet. And any of you who know us know that those are the folks that are at the top of our list most of the time. So we took up the challenge of let's find those people. And there's been some other really interesting projects funded around the ACA in California, and we wanted to build on those, take what they've learned and incorporate it and stretch it a little bit further. So all that goes to say that California just seemed like a good place to focus our attention. Now, the good thing about this is, since it's going through N.A.P.S, is that once we finish our focus in California, this material is available to all the states. So all the material and everything we develop is going to be available to anybody who wants to use it. So let's go to the next slide. I can't tell what you've got up there, so let's go to slide 14. Okay, so now we're on the slide with the picture of California on it. And here's the goals that we set for California. And this first one is no easy target. It's I'm going to underline the word inspiring training materials for peers to use to support participants to enroll in health insurance. Now, when you take something as complicated and complex and potentially boring as the ACA, and you commit to making that inspiring, trust me, that is a big job. But we knew if we didn't come up with inspiring material that it wouldn't be effective. So we put a lot of time and effort into taking the ACA, unpacking it, and figuring out how to make it inspiring. And we're creating that material so all of you will have it to use. We have a plan to disseminate it in California. And, once that's finished, it can be disseminated more broadly. we've identified areas in the state with the lowest health insurance enrollment rate, like I mentioned, and we're corresponding that to the peer groups in those areas. And those are the folks where we want to do some live training with the material and really give them a boost so they can hit the ground and reach out to those folks who really desperately need health insurance but haven't been able to, for whatever reason, take advantage of it yet. We've included a train the trainer aspect to this, training for peers. Well, they can use the material in the most effective way. And then we're, of course, implementing strategies that will address and minimize the effect of churn. We keep using that term, and I'm thinking that this is just going to be one of those things where you have to stay to the end. You have to stay to the end to figure out what the heck that means. But I'll just give you a little clue. It means people falling off and on eligibility. So those are our goals, and we're right on course with meeting them by September 30th. And if you're in California and listening to this, we'll be in touch. And if you haven't heard from us, call us, because we want to help you understand and use this material. So, Scott, I'm going to go back to you at this point.
Okay, great.
Someone.
Yeah. So we're going to talk a little bit more about the Affordable Care Act and find out what it is. As you may be aware, the Affordable Care Act is something that was implemented back in the year 2010, and sometimes it's simply referred to as federal health reform. And the Affordable Care Act is actually responsible for the most sweeping reforms of the United States healthcare system since the 1965 passage of Medicare and Medicaid. So, what are some of the key provisions of the Affordable Care Act? Meaning, what are some of the things that were changed upon implementation of the ACA? Well, the first one is expanded access to insurance coverage. The Affordable Care Act truly aims to provide health insurance coverage to millions of uninsured people by expanding access to both private and public insurance. Another provision is increasing participant insurance protections. And through the Affordable Care Act, it enacted several insurance reforms to accomplish things like prohibiting monetary caps on insurance coverage and excluding people with existing conditions. And for the first time, we saw a true emphasis on prevention and wellness. So the Affordable Care Act contains provisions to prevent illness and focus on wellness by creating a Prevention and Public Health Fund. And the Prevention and Public Health Fund provides grants for states for actual prevention activities. So, for example, in California was actually awarded a Medicaid Incentives for Prevention of Chronic Diseases grant a few years ago titled Increase Quitting Among Medi-Cal Smokers. And the actual goal upon receiving this grant was to support over 21,000 Medi-Cal participants to quit smoking. And these services are being provided through a counseling helpline, and Medi-Cal participants can actually receive $20 for calling the helpline, completing some paperwork, and participating in telephone support. And they also have access to nicotine replacement support. So this is just one example of how these grants can be used. And although I'm sure this list has grown, I'm aware that other states that have also received these grants, and they include Wisconsin, Minnesota, New York, Nevada, New Hampshire, Hawaii, Texas, and Connecticut. So I know that on today's webinar, we have many states participating. So perhaps your state is receiving benefits from the incentives now offered under the ACA. So another key provision is improving health quality and system performance. And so the Affordable Care Act contains several provisions related to improving quality and system performance. And one of those system delivery improvements is the development of health homes, which is something that we're going to talk about in a few minutes. And of course, another key provision of the Affordable Care Act is that it's intended to address the rising health care costs and provide more oversight of health insurance premiums and practices. So when we look at all of these great-sounding key provisions, how do we sum up why the Affordable Care Act is important? And what information should we be conveying to the participants that we support to encourage them to enroll in health insurance? I think it's important that participants hear the WIIFM, or what we would call what's in it for me. So our participants should really be hearing why the Affordable Care Act is important and eliminate any misconceptions that they may have. So these are the things that they should be hearing. They should be hearing that the Affordable Care Act helps make health insurance more affordable and accessible, something that we've been talking about. It's important for them to understand that the Affordable Care Act ends discriminatory practices. So it's important that they're aware that they can't be denied health insurance. They can't be charged higher rates because of a pre-existing condition. They can't be dropped from health care coverage if they get sick. The Affordable Care Act ensures that there are no lifetime limits on coverage, there's no annual limits on coverage, and the Affordable Care Act ensures that all health care plans that are made available include essential health benefit categories. And this is really important because that means that any plan will include ambulatory services, emergency services, hospitalization, maternity and newborn care, mental health and substance use services, prescription drugs, rehabilitation and habilitation services, laboratory services, preventive and wellness services, including chronic disease management, pediatric services. So each one of these 10 essential health benefits or healthcare services must be covered by a health plan to meet the requirements of the Affordable Care Act. And this is going to give participants confidence knowing that all these services are available. And also, the Affordable Care Act makes the process to get health insurance coverage easier with user-friendly systems and streamlined enrollment processes. Now, I'm going to kind of piggyback on what Lori said, because there's a little bit of a disclaimer here. I do agree that under the Affordable Care Act, the process to enroll in health insurance is made easier and it is more user-friendly, but it still can be very intimidating. So this is something that we're going to talk about in a bit. So if we get a little bit more specific into how the ACA is important to individuals with a mental illness in California, yes, it does allow participants easier and affordable access to health insurance. And when we think about the way California is structured, California is a state with Medicaid expansion. So California created their own market exchange, which they call Covered California, which includes access to Medi-Cal, and that is California's version of Medicaid. And Medi-Cal provides free or low-cost health insurance coverage for individuals and families. And also it's important because participants are able to focus on whole health and wellness. And when you really think about it, this is the philosophy or approach that we're striving to achieve when supporting the people that we serve, to be able to focus on their whole health. And then also, when a participant is Medi-Cal eligible, it also allows access to a health home. And the criteria that's used to make this determination is the person has 2 or more chronic conditions, the person has a chronic health condition and one at-risk condition, or has one serious and persistent mental health condition. And a chronic condition includes a mental health challenge, a substance abuse challenge, and a variety of different medical conditions. So when a participant is eligible for a health home, that includes those core elements that are identified on the screen there. It includes comprehensive care management, care coordination, health promotion, transitional and follow-up care, and referrals to community and support services. So under the health home model, these individuals will have providers that operate under a whole health philosophy. And health home providers will integrate and coordinate all primary, acute, behavioral health, and long-term services and supports to treat the whole person. So with that being said, I'm going to turn it over to Gene so that he can focus a bit on the actual role of peers. Gene?
Thanks, Scott, and welcome everybody that's on the webinar with us today, and thanks, Peter, for kicking us off, and Rita for hosting on behalf of N.A.P.S. Gene Johnson with Resilience here. For so many, many years, we've really come to learn the power of peer support for recovery, for helping people become engaged in an improved life. And where this started, peer support, when this started, peer support was kind of something that was on the side of the behavioral health system. It existed kind of outside the behavioral health system and really wasn't part of the mainstream of service delivery. Over the years, because of the outcomes that have been produced by peer support, because of the voice of peers and people in recovery themselves, peer support has gradually moved into the mainstream of behavioral health care, becoming a benefit in many states that is paid for under the public Medicaid system. What we have happening now is even bigger. So peer support is becoming part of the mainstream of health care, and we see peers having the opportunity to contribute to a person's whole health through being whole health coaches, and really focusing on the quality of people's health in general. So we look at the slide, we know that the outreach that has occurred has made a huge difference, and that has created meaningful engagement for many people who weren't even aware that perhaps recovery is possible. And of course, then we see action beginning to happen because the role modeling that peers play from their own lived experience inspires others to become active participants in their own well-being. Next slide. What is the important role that peers play in supporting participants in enrolling into health insurance? Again, role modeling. Peers can play a crucial role in being able to share their own stories related to health insurance enrollment and the benefits of maintaining health insurance. So here we're talking about peers that are actually using the Affordable Care Act, that have insurance coverage through the Affordable Care Act, who are experiencing improved health outcomes as a result of that coverage. But just encouragement in general. Peers are able to provide encouragement, I'd say motivation, activation as an important step forward. And just a comment on where we're at related to recovery and resilience. We all understand the aha moment of recovery. And we see that as getting over what's happened to me. Resilience is about the future, and resilience is about moving forward to prepare for the future, which is uncertain, which can often, and undoubtedly does, life happens, be characterized with adversity. And in resilience, people develop and have the strength to overcome that without getting taken out. And we talk about the 5 steps of resilience. You may wonder what we've come up with there, but let me share that with you. The first one is optimism. And in recovery, we talk about hope. But with resilience, we're talking about a much bigger kind of life view that's optimistic. We're also talking about taking an honest look at our fears and finding ways to face our fears so that they don't take us out in the future. In resilience, we're talking about a sense of belonging, really being part of the world, part of our family, having a sense of belonging, and that goes to a sense of purpose. Fourth thing is creating a whole community of wellness. So now, instead of finding our wellness or our health through the service system, we're actually creating wellness in our own community of choice. And of course, lastly, the step of resilience is that spiritual connection, which is a sense of real meaning and purpose in my life, making a contribution to others, being of service to others, treating each other with kindness and respect. 5 steps of resilience. Peers also can provide guidance, and that's really what we're focused on with this project. Peer who has information and the ability to guide a participant through the health insurance enrollment process and access to necessary resources is critically important. So, we've done lots of things to try to engage people, to try to outreach that will create engagement, that will get people enrolled. But really taking a look now at the power that peers have, people who have been through the experience themselves, people with their own experience of recovery and wellness, being able to reach out and connect with others who may not be enrolled in this benefit and getting them active around their own health care. Again, peer support, the power of peer support has just been one of the most exciting things that I can ever remember happening in our field.
Gene, can I interrupt for one moment?
Please.
Scott, there is a question from Ruth, and Ruth has asked you to take and repeat 10 services that you mentioned. Can you go back to that slide and go over that with her, please?
Certainly.
And then we'll have Gene pick it back up from where he just left off.
The essential health benefit categories include ambulatory services or outpatient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use services, prescription drugs, rehabilitative and habilitation services, laboratory services, preventative and wellness services, including chronic disease management, and pediatric services.
You know what I'm going to ask you to do, Ruth? If you were not able to get all that done, would you send an email to Scott? Scott, I believe you have your email towards the end of the presentation, right?
I'm not sure if I do, but it is simply Scott@resilience4u, the number 4, the letter U.us.
Thank you, Peter. Thank you, Scott. I appreciate that.
No problem.
I'm sorry. Let's get you back on track again. I apologize.
No problem. Glad to help.
Thanks, Ruth, for that question and clarification. Anybody else that has questions about what we're saying, just chime in through the chat function. I know I'm preaching to the choir here when I talk about peer support, so we're going to move on and get to this topic of churn, and Scott's going to get into that with us. Go ahead, Scott.
So, as Gene said, this is the moment you've been waiting for. If you've stuck with us throughout this and were wondering about churn, now's the time to learn. So, let's talk about what churn is and why it's a concern. As Lori had referenced earlier, churn is a term commonly associated with a participant that cycles in and out of health insurance eligibility. And this truly can be devastating because it results in a loss of continuity of any access, coverage, or care. And when I think about this, I get this image in my head of a car that has a full tank of gas, and then the car runs out of gas, and then the car's stalled for a period of time, and then the tank is refilled, only to stall again after a short time. And when we put this in the context of a person's health, that does not promote wellness. Because as a result of this, many things can result. As it shows on the screen here, missed doctor's appointments, test results that are either never read or acted upon, medical conditions that are not being treated at all or properly. And out of all of these, this next one often winds up happening because the participant doesn't have current health insurance, and it results in a visit to the emergency room. So what we see is increased visits to the emergency room. And it can lessen the incentives for health providers to invest in long-term wellness. So it can be certainly challenging for a medical provider to know that someone that they are medically supporting is going to have significant time gaps in between appointments, or perhaps they don't see that person again. But, out of everything on this particular slide, I think the most concerning point is when there is a decrease in the incentive for the participant themselves to not want to invest in their own long-term health and wellness. So if there is a way that churn can be eliminated, I think we can understand why this is so important. So how can peers help eliminate churn? Well, one thing is by being proactive. Support participants when they're about to experience any type of change that can impact their health insurance eligibility. Now, there's a number of reasons why a person's eligibility for health insurance may change. We know, and has been pointed out earlier, that if a person either loses their employment or they become employed, based on their income and that change, there could be a change in the health insurance eligibility. So having this information and supporting the participant through this change can make a difference between losing health insurance eligibility and having to start at square one, or being able to maintain a continuity of care. Also, a way that peers can help eliminate churn is based on the contracts that your organizations hold, ensure that peers are being utilized to the fullest extent. Peers can support participants in so many ways. And, Jean shared with you how important the role of a peer is and so many things that can be done. So think about the peers in your organization, and are the peers in your organization participating in all those activities, the outreach, the meaningful engagement, role modeling, guidance, all of those activities. And also, having continuous communication and bridging to additional supports. That's really important. Continuous communication engagement play a really strong role in eliminating churn. And when a participant has the ability to get connected to support services that they need the most, the chance of an episode of churn is reduced. And then also, promoting health and wellness through encouragement and the 8 dimensions of wellness. Now, we know that integrating the 8 dimensions of wellness into your everyday life is a practical way to start developing healthy habits that can have a positive impact on your physical and mental health. We also know that the 8 dimensions of wellness include emotional wellness, environmental, financial, intellectual, occupational, physical, social, and spiritual dimension. Okay? So a participant that develops healthy habits and who is in the driver's seat of their health and wellness will greatly reduce the chance of churn occurring. So there's also another way that peers can help eliminate churn by using a resilient action plan, and I'm going to talk about that in just a little bit as we move on with this presentation. I'm going to turn it over to Lori to structure the next area that we're going to be talking about.
Okay, thanks, Scott. This is just kind of a summary of what we've talked about in terms of our strategy. Let me go over it again with you. First of all, the challenge of creating inspiring and relevant material. Again, sounds easy, but not so much. But the good news is, I think we've done it. What we've put together so far inspires me, and I'm not easy to inspire, so because of my very short attention span. So I think we've got that handled. I just want to kind of interrupt myself and say, by the way, this has all been funded through SAMHSA and their BRSS TACS folks. And so what that means for you is that this is all free and available to you to use. And the more you use it, the happier we'll all be. So you'll be able to get it through N.A.P.S and use it however best suits you. There'll be a train the trainer part of this too. So that'll all be available to you, and we hope you use it as often as you possibly can. It will include, our strategy includes some webinars and some in-person training. Again, that's all free of charge. And then, of course, our third point is to disseminate the material throughout California and then make it available nationwide to anyone else who wants to use it. That's kind of our overall strategy, and so far it's looking really good. So, Scott, I think this comes back to you.
It does. It does. So I'll share with you a little bit more in-depthly in terms of what it is that we're creating. Okay, so as Lori has indicated, one of our strategies is creating inspiring and relevant materials for peer to use to support participants to enroll in health insurance. And as Lori has stated, this has really been one of our main focuses at this point of the project. So the first one is to create an easy-to-understand participant handbook. And in developing the participant handbook, which we're calling Finding Healthy Me, we wanted to design it so that it could be multifunctional and used in a variety of scenarios and situations. So that's why the participant handbook can be easily used when a peer is working one-on-one to support a participant. It can be used in a setting where a peer is supporting participants in a group. And it also can be used by a participant who may feel more comfortable learning about the Affordable Care Act and the enrollment process at home by themselves or maybe with a family member or a trusted friend. The participant handbook itself is designed to be appealing, easy to understand, and convey to the participant that enrolling in health insurance can be easy and fast. And I think a lot of times when we think of having to complete any kind of application or go through any kind of enrollment process, sometimes we have a tendency to approach it with a bit of procrastination, and that's regardless of whether it is actually truly easy or challenging. So I think it is really extremely important for the participant handbook to be easy to comprehend and break down the application and enrollment process so that it is very, very easy to digest. Now, we're also creating the Leader's Guide that promotes participant engagement. And the Leader's Guide is designed to support the peer who is working with the participant or participants. It provides a bit of more in-depth information about the Affordable Care Act. It goes into information that we talked about regarding Churn and how to help eliminate it. And really most importantly, it focuses on engaging and supporting the participant where they are at. We know that every participant that we support may be at a different place in their recovery and resilience. So the peers can use the participant handbook to begin to build the participant's knowledge and confidence so that they will not only pursue enrolling in health insurance, but also take control over their own health, their overall health. And then here's the other piece that I indicated earlier that can help eliminate churn is by using a resilience action plan for activation and ongoing participant support. So I noted earlier that the outward focus of the participant handbook is to encourage the participant to learn about what the Affordable Care Act can do for them and enroll in health insurance. And during this time, the peer is supporting the participant in this engagement activity. But what's going to happen, or what's going to help support the participant to the level of activation and to support them to continue to move forward with other health goals? Well, by using this resilience action plan, and within the participant handbook, this actually is the last component of the handbook itself, is an actual resilience action plan. Now, the resilience action plan is not designed to take the place of a participant's quote-unquote traditional service plan or treatment plan. The resilience action plan that we are integrating into this process is a very simplified planning tool that can be used for generating one short-term goal and solution that the participant wants to focus on, and it's completely participant-driven. We used the metaphor of a garden resilience action plan, which makes it really inviting and fun to use. And even the first line on the resilience action plan states, "Congratulations on your pursuit of obtaining health insurance. What can you do today to support finding healthy me?" So depending on where the participant is at, their short-term goal or solution may be to actually start collecting the documents that they need to enroll in health insurance. Or if the participant has successfully enrolled in health insurance, maybe the goal or the solution is for them to make an appointment with their health home or primary care physician. And then, of course, when a goal or solution is achieved, it's time to celebrate the accomplishment and encourage the development of another goal. So by using this resilient action plan, and not just once, but focusing on its continued use, it is another great way to help eliminate churn. And then also, as Laura had mentioned in regard to our strategies, we're going to use two different types of delivery models to get this information out, because we really, truly want to get the word out to everyone in California about these materials and resources that will be available to them. So during the course of this project period, we're going to be doing in-person training to selected organizations within California, and then also via webinar to organizations within California. And I think at this point we have slated at least 8 webinars, which will be open to all California organizations who support people with mental health challenges. We have a large network of email distribution lists and connections with key California stakeholders, and a truly exciting technology platform to be able to conduct these webinars. And as Lori mentioned earlier, through the connections with various stakeholders, we're identifying the areas where there is the highest amount of churn or the lowest enrollment rates, so that we can target our efforts and hopefully result in a higher success. And so I'm going to turn it over to the last slide for Lori to touch bases on.
Lori, while you're thinking and getting ready to do your slide, I want to let people know that in the chat box, I put down the 3 addresses for Lori, Jean, and Scott. So please go right into the chat box. If you want to communicate with them directly, you have their email address. I'm sorry, Lori.
Thanks, Peter.
Just go ahead, Lori.
Good reminder. Thank you of that.
No, don't worry. This is getting you up one.
Okay. So this is just kind of a final reminder that we're focusing on California, like Scott's saying. And once we get to September 30th and have finished our focus on California, these returns are available nationwide to anybody. So feel free.
Lori, Jean here. How would people access that?
Scott, do we have that figured out yet?
I think our true focus right now has been in our efforts to focus in on California, but I'm sure through our networking and the contacts that we have been making throughout all of the various states, that we will be able to start trickling, getting the word out, and it's something that will, I think, just continue to be reported and conveyed on an ongoing basis.
So I would say just send us an email, and when the materials are available, we'll see that you get them in your hands.
That sounds like a good solution of the problem. Thank you, Jean.
Absolutely.
I think I'd also recommend that people don't have to join with the $25 fee. There's a free mailing list for N.A.P.S, and if you're on the free mailing list, you'll be getting information about this wherever you are.
All right, Rita. Should we go to the next slide? Here's our Q&A. So we have about 7 minutes left. Does anybody have any questions that they want to use the chat box function to bring forward to ask our 3 very, very distinguished and carefully skilled individuals that gave us a wonderful webinar that's thought-provoking and ways that we can help our people to stay connected to the good services connected to, instead of taking and having to settle for second best, third best, fifth best sometimes, depending upon where the situation that any one person is over. So first of all, let's thank our presenters for doing a great job of presenting very important material to us. And here's your opportunity to ask them any questions you have. Gary McGinnis says thank you to everybody. Ruth loves the 5 steps of resilience. Some people are leaving because they're not interested in Q&A. Will this tool be able to help communities that are considered low income? That's a question from Liz. Scott, do you want to try to address that?
I'm sorry, could you say what the question was again, please?
Will this tool be able to help communities that are considered low income?
I think that the materials and information will be able to support truly any environment or any community.
Whether it be low income or not.
Regardless, yes.
Yeah, I would think that there would be a significant need in a low income environment for people to get connected to, relatively good health insurance coverage.
Well, again, just a comment. That's the significance too of peer support, because so many people with lived experience have experienced poverty, have lived in poor areas, know how to connect with people that are still stuck in that condition. Peer support can really make a difference in low-income communities.
Good point. Very good point, Gene. Thank you. Gary McGinnis asked for briefly review the 5 steps. Scott, was that a slide that you did?
Actually, Gene went over the 5 steps of resilience.
Okay. Gene, could you go over those 5 steps of resilience with us again, please?
Well, yeah, I shut my PowerPoint down, but help me out here, Scott. So we're starting with optimism, which is a life view that goes way beyond hope. Then we take a look at facing fears, and often in recovery we've been focused on our strengths, and that has been really a bridge to a better future. But now we're going to take a look at what's getting in the way, what has gotten in the way of being able to face those fears with real strength. A sense of belonging, really being part of the mainstream, part of the world, part of my family, part of my friends, creating a sense of value in my life. The 4th step is community belonging. So people moving beyond us, moving beyond the mental health system, creating their own real sense of community where they belong and where they have an important contribution to make and can be of service. And then finally, that spiritual connection, which is so important in recovery, about finding my purpose, finding meaning in my life, and tapping into my spirit as a real tool to help strengthen and build my resilience.
All right, and Gary, what I'm going to suggest to you is if you do want a copy of the Resilience Action Plan, you can mail either Gene or Scott and get that from them. I have a question from Susan. The question from Susan is, what is the timeline of release of the materials after September 30th?
So this is Lori.
What the deal is on that?
This is Lori. I'm just assuming it would be immediate. Materials are all...
For the 30th, they can just go to a website, pull it down?
It would be on the N.A.P.S website, yes.
Well, yeah, this PowerPoint will definitely be on the N.A.P.S website in about 2 weeks, Rita?
Yes, but I think they're asking about the actual materials for training, and that also is intended to go on the N.A.P.S website later on after September 30th.
Oh, great. Okay, good. We're getting a lot it won't be until after September 30th. Is that what you're saying, Rita?
I think it'll be almost immediately after, though. That's when the project ends.
Okay.
Right.
Well, that's what I'm wondering. Lori, it'll be available in California now?
Well, I think so. I think we're pretty much ready for that. We'd like to be able to meet with people and give them a little training in how to use it. But if they just want to take it and run, they can do that too.
All right, well, folks, I want to thank you all very, very much. I want to thank the participants for taking time out of their day. I want to thank our wonderful speakers for taking and doing a great job.
Yep.
You do have their email addresses in your chat function, so please, if you want to email any of the three of them, you can do that. Rita, it goes without saying that without you, you're the glue that keeps us all together, and we thank you very, very much for that. So we've got a couple more slides that we're going to go through, just to let you know how you can take and link up to the getting your certificate. Now, this is very clear, very simple. It is a member benefit. You click on I.N.A.P.S and you click on the upper right corner and follow the instructions, okay? Take the webinar credit quiz, and then your certificate will be taken and sent to you in a period of 1 month. Is that correct, Rita?
Yes. 3 to 4 weeks, yep.
3 to 4 weeks, okay. We go to the next slide, Scott. Join us for the 10th Annual Peer Support Conference and Summer Institute. Tell you what, Rita, why don't you take over this section, because this is more your stuff than my stuff, okay?
Yeah, no worries. I just hope that everybody will think about joining us in Philadelphia or just helping to promote the conference, because it's going to be a great conference this year. So we have 60 advanced level presenters. We've got a half dozen really nationally known speakers that are going to be presenting, and we've got a week's worth of summer institutes, as well as we're also getting CPRP credits for a number of our workshops that are coming up. So join us in August.
And I'll put a shamelessly put a plug in for a workshop that we will be doing there. Somebody that I work with very closely, Alan Daniels, and I are going to put together a workshop of how to work with you to advocate for getting a better salary from your employer, based upon a wage and salary survey that we did with over 1,600 people last year. Is there a next slide after this, Scott? Okay, our next webinar is July 8th, and we have Gayatri Raversat, who's going to be taking and talking with us, and she'll be talking about Be the Hope, which you can find on her TED Talks. I also just recently gave her a video. She's got a website that You Can Recover. Now, on that website, there's various people that are taking and telling their personal recovery story. So I think you're going to thoroughly enjoy what Gayatri has taken off of the group on July 8th. And do we have one more slide, or is that it? Thank you very much for this, Rita. I appreciate it. Optum, this is a partnership with Optum and I.N.A.P.S, and we're going to stay a partner. So, Rita, is there another slide after this?
One more, and we're done.
Okay.
Thank you.
We want to thank everybody. Listen, folks, have a great day. Thank you for your valuable comments. Thank you for all your input. And thank you for all your hard work. You've been a wonderful audience, and we certainly have had some skilled presenters with us today.